Welcome back, everyone. We're moving now into a conversation that sits at the very heart of our mission here at HEHI, from risk to resilience. We're looking specifically at the emergency preparedness across the African continent. It is my pleasure to welcome Dr. Dick Chamla, the emergency preparedness lead at the WHO Africa Regional Office. He's joined by our faculty director, Dr. Louise Ivers, who will lead the conversation. So please enjoy. Thank you.
Thanks. Thanks, everyone, for joining us back after the coffee break. And thank you, Dr. Chamla. It's a pleasure. I'm going to start with a few questions from me, but then we will open it up to your questions. So please get those ready as we go through. So you have worked across national ministries of health, WHO Afro, you've done frontline outbreak response, and now you're working on regional preparedness systems. Can you tell us a little bit about the through line that connects those experiences for you, and whether there's been a specific moment in the field that fundamentally shaped how you think about emergency preparedness?
Okay. I really appreciate an opportunity to be here again at Harvard. I think, and also I really appreciate an opportunity to really talk about preparedness. Globally, it's only few people who are talking preparedness. Oftentimes, at the time we're talking of emergencies, we're only talking about response. So I'm so grateful I'm here, I'm talking about that. And hearing from a previous panel, I need to remind all of you, in Africa, we have every year 100 to 120 emergencies every year. And these emergencies are ranging from outbreaks, from climate-related disasters, and also from armed conflicts, aka humanitarian crisis. As a result, at the time you're all talking about priorities in health, at the time you have emergencies, all priorities change. Because entire healthcare has to respond to these emergencies. As a result, I didn't hear it a lot in the panel. It's okay to have emergency main priorities in terms of peace. At the time it comes to emergencies, all priorities will always change. Specific on your issue, it's true I've worked in a lot of countries, actually in the past, over 20 years now. Therefore, I'm old already, from a definition. And that in frontline, I've been really working in Africa, in the Middle East, in Afghanistan, and even in Papua New Guinea. And what I've seen and I've learned in all the countries, it helped me to create the information and the evidence in which it helps to inform the policies and the national strategies. At the time, I was actually at the national level. And at the time I had an opportunity to work at the global level and the regional level, it helped me to see how all those lessons I have from the ground, it was help actually to influence global policies, global strategies, and other things. As a result, what I've really learned in all years in emergencies, we are always reactive. We are not oftentimes proactive. We wait all the way until at the time we have an outbreak or an emergency is the time we are actually starting to act. So what I decided and started to ask, how about if we have appropriate tools and resources in which it will enable us to predict a future in order to prepare and protect the lives of the people and economies. As a result, is the reason I decided to shift from a response to preparedness, because I believe preparedness had the long-term impact and the response has only an immediate impact.
And building on that, I've heard you say before recently in Nairobi at a meeting you were co-hosting as WHO Afro that preparedness is becoming a continuous discipline rather than an episodic activity. And that philosophical shift that you've also mentioned in your opening comment, could you speak to us a bit about what needs to change institutionally at a practical level and culturally for governments and WHO country offices to operate in that kind of way, and what opportunity there may be in this moment of global health to create or to accelerate that kind of shift.
Okay, excellent. I really believe preparedness intersect between emergencies and the development. Okay, and even at the moment, how emergency preparedness are measured by the average score of core capacities of international health regulations, bracket IHR. And if you really look, actually IHR core capacities in which are reflected in Annex 1 of IHR, actually you will realize a lot of core capacities are actually the building blocks of health systems. As a result, you wouldn't have a strong preparedness if you do not have a stronger health system. And in order to strengthen preparedness, it implies you really have to have a long-term investment, okay? And the problem is our countries, our government, and even in the WHO, how we are structured is actually we assume preparedness is one-time intervention. Mm-hmm. And actually it doesn't work like that. It needs a long-term, actually, investment. How do we change that? It's really, we need to relook at our structures, okay? We have structures in which are organized in boxes, as you know. I am preparedness, another one is response, another one is data, et cetera, and we have to see how are we able to integrate or even to explore opportunities of collaboration in order to ensure we have a complete management cycle. As a result, I feel it needs time, we need reforms to do that, and actually to also have the mindset. So we also have to actually bring in our donors, because our donors are also interested on the results in which are immediate, instead of the long-term results, etc. So opportunities we have at the moment, example, 2.5 years, we have high-level political declaration of emergency preparedness and response in which it was adopted by the heads of statement. And in the declaration, it articulated one critical thing. It recognized primary health care as a critical pathway to strengthen emergency preparedness and the UHC. As a result, how we are heading in the future now is actually trying to recognize that if we are able to create emergency-ready primary health care, actually it will have the longer-term impact actually on preparedness. And another opportunities, we have now global financial instruments such as pandemic fund, in which critically has already recognized it's critical at the time we are talking about preparedness. We also talk about strengthening the systems. It's a reason that is also another opportunity. And actually, a last opportunity I will remember at the moment is actually even our own regional office of Africa in WHO. We are now creating a regional strategic plan in which we have already recognized to frame preparedness as a part of health system strengthening. Over.
You know, thinking about the structures that you spoke about and the continuous preparation, it makes perfect sense that primary healthcare and health systems are needed for that. Though it's really not that often that I hear those things in the same conversation or the same, or even the same people. So it's very interesting. And could you speak a bit to how practically you think that might move? Will pandemic fund be available for primary healthcare strengthening? How can countries, especially maybe building on the discussions we had earlier this morning, how do you see that really happening?
Anyway, it has already commenced in part. Example, if you see round 1 of pandemic fund and round 2, clearly it articulated priority areas of pandemic fund is strengthening early warning surveillance to health workforce. The last one, it was laboratory. And it says across this area, try to think how community health, it will play a stronger part on that, to the One Health approach, and the last one is strengthening institutions, including national public health institutes. Actually, it has already started there. So we have also other, yes, I'm sure in the morning here also you have heard of this African ownership agenda, the political agenda now, in which our heads of state now have clearly said we have to take ownership of our health. We have to take ownership of our preparedness initiatives. And one of the issues everyone has already critically tried to think now is how are we able to include the preparedness actually in the national budgets. As a result, we start to see the movement. We need to actually see more. A problem is, yes, we have statements, the issue of implementation is always slow.
Sorry. Well, building on implementation, one of the things you recently implemented was the preparedness data exchange. And I think we have a screenshot of this dashboard, a comprehensive dashboard that's AI enabled, where you bring together surveillance, climate data, other monitoring. Can you speak a little bit to us about your vision for this and what it will do in practice and what opportunities will emerge from this, and maybe what challenges you see to implementing it, or how it might be used best?
Yes, excellent. Yes, I'm really glad actually to see it there. Therefore, the PDX, Preparedness Data Exchange, is our new innovation actually, in which we are trying to see how AI it will be helping us in actually strengthening preparedness. So what we have really done is to try to integrate actually all the data related to all hazards here. I'm talking about climate-related hazards, I'm talking about outbreak, I'm talking about also crisis, humanitarian crisis and others, plus capacities. And capacities here, I'm not only talking about preparedness per se, as IHR core capacity, I'm also talking about primary healthcare capacities. And we have embedded an AI agent here in which it's helped us to have a real-time analysis of what is happening. Okay, because what is happening, as I've alluded earlier here, actually in Africa we have a lot of emergencies. As a result, we spend around 80% of our time responding. Therefore, we have 20% to think about preparedness. Therefore, the idea is how are we able to optimize available time in order to close the gap between alerts and decision making. As a result, we thought AI, it will help us. And also, two, we have fragmented sources of data. So we have EIOS example, you have all had epidemic intelligence from open sources, is from one source. And we have, for instance, SPA data from another source, and the hazard from another source, okay? And in order to bring all these sources, in order to analyze, to understand what is happening, it actually always takes time. As a result, here the PDX, in which it enables us to bring all these sources together, to analyze it in a real time. And actually, we've also linked it with the NASA in such a way we are having a real-time climate intelligence in which it will help us to see what is happening. So we've also added the political alerts inside in a way. For instance, if we have a coup d'etat happening in a country X, we have an AI agent in which it helps us to understand what is happening in the country as economic indices, in which how are they playing around, okay? Stock exchange, how are they behaving at that? And at the end, it asks us, do we see an imminent threat here of humanitarian crisis to happen? As a result, we have all this together. And the last issue in which we have really done here, we have also added a large language model inside. In such a way, the Ministry now of Health, or the Minister of Health, is able to query. We have a place there, Ask WHO, Actually, you are able to query in the ASCII WHO, actually, what are the strategies to immediately address a threat you are seeing? And you'll have the answer initially. Our aim is that instead of the ministries of health, every time they have a crisis, to ask where is the WHO, we try to ask the Ministry of Health to have preliminary information in which it will enable to start action. Okay? As a result, the PDX is really trying to have an integrated preparedness intelligence in which the ministries of health are able to determine alerts in a real time and actually take action immediately.
I know you would probably talk about AI a lot because you're an early adopter and very interested in its opportunities. Can I ask you, I mean, one of the potentials around AI is really in service of humanity, but there's also a risk with data and data ownership that it can really serve wealthier communities, wealthier countries. How are you thinking about safeguarding to ensure that some of the use of AI, whether through the PDX or other, is going to really benefit the African populations from where the data is actually is coming? Is that something you're thinking about?
Yeah, we have already actually trying to do that. And actually in Afro, we have actually having another initiative. We have now created an AI framework for Africa in which it enables us to actually including ethical imperatives and other issues inside. And actually one of the issues we've all realized, I hope all of you realize, actually in one way or another, we will have to have a collaboration of Western countries because the technology is from there. We have to agree on that, okay? Our collaboration though have to be a win-win collaboration. Okay, for us in Africa, we have data. Where the data is from epidemiological data or even laboratory data, the pathogens data, etc. We have them. We have real needs. How are we able to have a discussion with our counterparts, see actually of the West, and see how are we able to collaborate in a win-win basis? I'm sure all of you have heard of INB negotiation, actually intergovernmental negotiation body in which we are trying to negotiate on pandemic agreement. It is actually in the premises we're talking about. If the West is able to agree on terms of the transfer of technology, example, to Africa to enable us to operate our tools, if the West is able to agree on collaboration on research and the development, okay? If the West will be able to agree to share actually experts, either in exchange terms or others, yes, I hope Africa will try to think and say, okay, if the issue is only have access to our data, we'll see how actually we're able. As a result, in short, is really about win-win. Because Africa will have a need, Africa will have data. However, we have to agree a technology is also from the West. How are we able to collaborate in order each one of us has a win is an issue in which we're promoting at the moment.
Thanks.
Yeah.
I'm going to pivot a little bit to talk about the health workforce and preparing the next generation. Many in the audience are either involved in medical education or public health education, and we have many students and students online. And how do you what skills or mindsets do you wish more graduates came into this work with? And what does the World Health Organization, at least in preparedness and response, need from academic institutions, whether in the global north or on the continent, that you're not currently getting?
Yes, actually, it's really, really an excellent question. Actually, in the year 2022, Africa created an African Health Emergencies Strategy 2022-2030. And one of our priorities in the strategy, it was on how to strengthen emergency health workforce. Okay. And after initial years of implementation, we realized we have a fragmented emergency health workforce cadres. We have, example, emergency responders, we have epidemiologists, there's a field epidemiologist, we have a plethora of actually training modules in which are out there. And actually last year we agreed we tried to bring together all the cadres, actually all of the disciplines, including EMT, emergency medical teams, together and create Global Health Emergency Corps. And under the umbrella of Global Health Emergency Corps, we created, or we are creating now, an African Health Emergency Corps, okay? Now, a problem is we still think we only have the people who are graduating from school who they haven't had any training on emergencies, are only coming in emergencies. We are trying to train afresh. So in the future, what we are really thinking, how about integrating emergency curriculum actually into health professionals, for instance, in the medical school or in the nursing school, etc. And we've already started exploring the interest among our member states, and it looks clearly they have a strong interest on that. So I really feel our issue now is to understand what kind of a curriculum of emergencies have to be integrated at which level. Mm-hmm. In my side, I'm more interested on strengthening emergencies, capacities, and skills among community health workers. Because in the WHO, we believe emergencies starts and end in communities. Therefore, it would be appropriate to see how are we creating an emergency-ready communities in which it helps us in either identify the abnormal trends in the community and actually trying to refer it to the appropriate authority. So academic institutions, you have a role there because I hope you'll be actually able to help us in even creating a curriculum of emergencies itself, or even trying to create a training program in which it will help us to actually include. Yes, another area you'll help us is the research. On the research on how do you think we should structure our research, identify appropriate competencies in which, for example, a community health worker have to have, or even a nursing. And actually on the last part, I feel is evaluation of the training models, because now we have so many training models out there, and really we don't know actually which one has higher impact over the other. Okay.
Great, thanks. Can we talk for a minute about One Health? So countries across the region are facing numerous threats, and you mentioned 100, 120 emergencies every year. Mm-hmm. And many of those threats are really at the intersection of human health, animal health, environment, the planet, climate. How is WHO AFRO advancing the One Health approach? And what might it take, do you think, to advance from the conceptual alignment on the issue, which again is sensible, mm-hmm. but sometimes in operational pragmatism is challenging?
Okay, an excellent issue, bringing it here, and I hope all of you understand. Last week we had the Global One Health meeting in Lyon, France, in which it was organized by the government of France and also our president from actually Ghana. Okay, issue is One Health. The WHO is the part of a quadripartite collaboration on One Health. A quadripartite, it is actually a platform in which UN agencies, FAO, WOA, the UNEP, and the WHO are coordinating the One Health. And what has happened ever since is really trying to come up with plan of action of One Health, a global strategy plan of action in which in the WHO AFRO we have tried to come up with a regional plan, and also trying to emphasize in the country level to create also the national plan, including a coordination platform, the One Health coordination platform, having actually interoperable surveillance systems between animal and human and others. Actually, implementation is uneven among the countries, honestly speaking, and also we are supporting the country to have a national bridging workshops in which we are having animal health expert and human health. A problem or an issue we have in Africa is that at the moment Africa have a really a complex the landscape in partnership. Therefore, as I say, the One Health is coordinated by the UN agencies. We have other agencies in Africa in which also are prominent in the public health emergencies area. I'm talking here about Africa's CDC, I'm talking African Union Humanitarian Agency, I'm talking about REX, the regional economic bodies like SADC, like East African Community, WAHO, and others. As a result of that, we are trying now in Africa to see how are we able to bring everybody on board. So we have two actions ahead of us we are trying to see. Action one is actually to create a continental task force on One Health, in which we bring everybody on board. And action two in a WHO specific, I'm trying to think if we'll have the One Health resolution in Africa with RC. We've been talking of One Health globally, but there is no any global resolution in the World Health Assembly on One Health. As a result, Africa, we are trying to create that, okay? And if we will have the ministerial endorsements, I feel it will be an excellent step now because, I mean, actually, we will have obligations on their side. Yeah.
Yeah, we talked about the declarations and then the implementation,
Yeah.
but the declarations are helpful to move the implementation forward too. So let us open it up to the audience a little. So if you have questions, please raise your hand.
Yeah, thanks. Great talk. So my question is, how do we get, or is it worth considering getting from response to preparedness to prevention? And of course, global health does prevention with vaccines and so forth, but I'm specifically talking about climate change. And I'm wondering from your perspective, Dr. Chamla, is there a role for public health professionals, for health professionals, for climate change experts to, but in particular in health, to work on prevention? And if so, who should do it globally? Should it be the wealthy countries? And how should they do it? How should we prevent the crisis that is affecting your countries the most for climate change and health?
Do we have any online questions? We'll take one more and then.
Yes, we have one online question which asks, how can international policy frameworks better support such grassroots AI innovations to ensure long-term sustainability and resilience in African rural communities?
Yeah. Okay, any other question? Oh,
Up at the back.
yep.
Thank you so much again for the great discussion. So my question is actually linked to the countries affected by conflicts and instability. So from your perspective, you know, the WHO perspective, how are you envisioning the aspects of interacting with non-state actors with the non-state actors in the efforts linked to preparedness and response, generally speaking, for emergencies? And another element linked to the protracted crisis-related aspects. So you said, you know, you are looking at the preparedness as a stage for development activities as well. So how are you currently engaging, you know, with the different countries across the health ministries? For example, with primary care, you know, the aspects linked to the tertiary, specialized care as well. And it's interlinked with the emergency preparedness efforts. Thank you.
Okay, that's a lot to chew on.
Yes, so we have another one there. And actually, it's all tough questions. Yeah.
Hi, Jessica Haber from Mass General again. So My question is very similar to what Anmar just asked about coordination of different institutions, ministries of health, et cetera. And you started to get to that point with the last discussion on One Health. But with regards to Africa CDC in particular, I'm wondering how the WHO is engaging with that as a coordinating body across the continent. Thank you.
Okay, so climate change. Yeah, climate change, who will lead that, who will be able to help us? It's really, really an interesting question, because in the WHO, we have two things in which we are trying to talk. We have one thing in which we are managing in emergencies teams. We have another thing in actually another cluster. And here I'm talking really climate adaptation or climate mitigation, climate change mitigation. Therefore, to us in emergencies, we are really talking about adaptation more, okay? Because we think our capacity, our mandate, it allows that. Because the impact of climate change in emergencies, it isn't only on increasing frequency of flooding or actually on the natural disaster. We have another impact of climate change in emergencies. We are slowly seeing epidemiological change of the occurrence of our outbreaks. Actually, Marburg, it didn't happen actually in the past in Ethiopia or even Tanzania. It happens now. The reason is simple. We are seeing a migration of birds and insects out from actually normal places or the normal habitats in which we're there. As a result, here is actually our concern for us in emergencies, and is a reason we decided actually climate adaptation, it is our priorities at the moment. We are also collaborating with other institutions to do that. However, how are we able to influence for instance, the impact of climate change in which is coming from another countries is always outside. It's really outside our scope of work. However, we have other agencies in UN, UNEP, for example, in which it is actually playing a critical role on that. And is the reason we have a platform of One Health, in which it has also included UNEP on that, okay? And how have we been able to engage grassroots? It's an issue in which has repeated over and over. And I think one of the issues we have already talked at the time we're creating our AI strategy is actually to have a peer review of our strategy. And in the peer review process, we've included actually the people at the community level. And our issue at the moment in which we've encountered is actually at which level are we able to actually bring in the people at the grassroots level. As you know, AI is highly technical area. Actually, it has coding issues, et cetera, et cetera. As a result, it was only that. And at the end, we agreed we would be able to bring grassroots level on the issues of ethics, okay, applicability and uptake in the country. And actually on the last issue, it's actually to hold the government accountable. I mean, actually in its implementation. The conflicts, yes, it's really an interesting issue here because the WHO, as you know, is a UN agencies. We are operating under actually a framework of international humanitarian laws. I'm sure all of you are aware of that. Globally, we have cluster approach in which we've agreed to implement from a time of humanitarian reforms in which happened in 2005. So in humanitarian reforms, WHO had a role as a health cluster lead, okay? And our involvement with the government is actually on the issues associated with actually health in crisis. A problem in which we have encountered is if the government is a perpetrator of the crisis. And actually, how do you operate that one, okay? Me personally, I've worked in, actually under Taliban. And even I started prior to Taliban. So we had Taliban actually overseeing an area of work closer to half of the country at that time. It was under Taliban. And actually the other half under the, actually a normal government. And if you're talking of the prevalence of, at that time of the polio, actually predominant areas of polio, it was under Taliban area. As a result, to organize a campaign of polio and others, we have to have access to that how do you call it at that time, a rebel group, Taliban at that time, okay? Mean to have access. As a result, we are trying that because we feel that health is a right of everybody. As a result, we have to work even across the non-state actors. So we have a framework in which we are operating, how to negotiate or even how to have access to non-state actors, actually in which we are operating with. On the protracted emergencies, I mean, I'm sure all of you I'm sure you remember, I think it was in 2016, we have humanitarian conference in Turkey, in Istanbul, and in which one of the issue in which it was brought, it was humanitarian development and the peace nexus, okay? As a result, in the protracted emergencies, it's a place in which we have already started implementing that. Therefore, in the WHO Afro, we have created a framework of health in humanitarian development and the peace nexus in which we are actually operating. An issue here now in protracted emergencies, we have to have also a strategy on how are we able to integrate our emergency issues into a development agenda. Therefore, we don't have enough time. Yes, we have an excellent collaboration with Africa. CDCs, we have a framework, it's Emergency Action Plan, it's called. Now we are trying to include other actually areas of work like health systems and others. Yes, but it isn't as rosy smoothies. We have some hiccups here and there. We have to admit on that. We have another platform on actually continental IMST you have heard, in which it was created at the time of MPOX. So we have small issues happening here and there, particularly on the declaration of public health emergencies. As you know, globally we have IHR Annex 2, article in which we say clearly is where public health of emergencies of international concern. Under another article statute of African Union, we have another actual declaration actually at the regional level. And the last 2 weeks we were in Johannesburg. They tried to bring everybody in Johannesburg to see how are we able to align in between the regional declaration and the international declaration. So I should end up here, I think.
Yeah, well, thank you so much. We really appreciate your expertise and spending time with us. Thank you, everybody, for your engagement. And please join me in thanking Dr. Chamla.